I'll be in a little bit. Hi, Dr. Pelto here. I have a patient, and a few weeks ago she had a nail removed on the right big toenail. And you can see there's some redness, and this is healing very, very nicely. The issue is with this patient, it's a little bit different because now she has a similar problem on this toenail. If you see it, you can see that the nail is kind of lifted, and it's a little bit painful. I've already numbed it up, just so you know, because everyone asked me, did you numb it yet? And I numbed it. Now, this patient has something interesting. She's getting chemotherapy for her cancer treatment, and one of the side effects of cancer treatment or chemotherapy specifically is that it can cause nail and skin problems. And one of the main nail problems is the nails can become lifted and loose on this area. This may be from the trauma to the shoe, from just slightly hitting it, but now because of the chemotherapy, it affects all the other cells. And the way we do this, since it's all lifted and loosened all the way into here, you see that, how deep it goes down into there, and because of that, there's some drainage. So one option we talked about was trimming back the nail to where it's attached, and the other option, which we're actually preferring, is to remove the toenail just like we did it, because it's a little more predictable in terms of treatment. It's more predictable. Whereas if I remove a little piece, then you have to come in again and remove a little bit more of it. And the way you remove it is just like with any other nail. You free up the skin at the base, and you free it up right here. And it's very, very loosened, so this is really easy to lift it. Usually it's a little bit more, it's actually become detached. And you can see there's fluid underneath it. And then to remove the nail, all you do is you just go underneath it and you lift, and that will allow it to kind of come off. And you can see it was totally detached there. It's all loose and hardly anything is attached. Now, I'm not sure why the chemotherapy does that, but it feels like it's kind of like damp and wet, almost wet, like dishpan hands. You can see all this just wet, damp skin underneath here. And you can see it's mostly on the side, and it just looks wet.
Oh.
And I'm going to trim off some of the skin here, so we're just finishing up. Okay, so everything looks nice and clean now, and eventually this, in a couple of weeks, is going to look like this other toe right here. In a couple of weeks, it's going to heal right in. So I'm going to put a little bandage on there now. And now the concern is, and we talked about this before, this patient currently has a couple more sessions of chemotherapy. And so there is a risk of some of the other nails being affected, but they haven't gotten affected. And also this new nail that's growing back on the other side, it could become loosened. But hopefully once all that therapy is done, the nail will go back to being totally normal and will reattach. So I don't usually see problems after, but I do see a lot of problems with nails getting loosened. But more commonly what I see is a nail that is ingrown. So I also see ingrown toenails with this condition. So you're going to see here my little smiley face that everyone likes. Okay. Good job.